Welcome to Deciphering Growth, the show that explores mental health from every angle. We bring you conversations with personal opinions, stories, and practical tips. We aim to break down the stigma and help you live your best life. So please sit back and let's dive in. Before we begin, we want to remind our listeners that this podcast represents the opinions of Tiffany Graves, Eric Stone, and the show's guests. The content here should not be used as medical advice. It is for informational purposes only, and please consult your healthcare professional for any medical questions. Views and opinions expressed in the podcast are our own and do not represent that of our places of work. This podcast should not be in any legal capacity whatsoever, including but not limited to establishing a standard of care in a legal sense or as a basis for expert witness testimony. There is no guarantee regarding the accuracy of any statements or opinions made on the podcast. In no way does listening, reading, emailing, or interacting on social media with our content establish a doctor-patient relationship.
All right, guys, we're back this week. We are going to do a role play, as we mentioned in our last podcast. We do kind of just want to give a disclaimer on top of our normal disclaimer that this is not a one-to-one representation. It is strictly a role play to give insight into how we can prepare for uncomfortable interactions within a medical professional setting.
Yes, I would just add that I have friends and family and clients that work in the medical community, so this is not meant to be bashing of that particular profession. I think there are so many skilled medical professionals and clinicians and trauma-informed who do fantastic work each and every day. So this is not a critique of all medical professionals. It is coming from a space Tiffany and I are in as working with folks with medical trauma and the just real pain and trauma that these kind of interactions can have. At the same time, if we can introduce this role play, we're making some assumptions in the way we're setting this up. So one of the assumptions we're going to make is that this is an initial meetup, and it's not been explained initially in any way to this patient. And before these interactions, that everything had been okay, like with this provider to client. Patient. So everything would be normal up until now. And the last piece of this being trauma informed is we cannot always prepare ahead of time for things like this. So we are not wanting to survivor shame anyone who has gone through an experience like this and has not advocated, nor do we mean to say that people do not need advocates going with them to medical appointments to be that advocacy for themselves and dealing with chronic conditions. So all that being said, just want to set the scene. The goal of this is that maybe some folks can find a few ways to respond in a way that they can feel more positive and maybe with less of that energy that turns into trauma. So with that all being said, Tiffany is going to be our patient. I am going to be a doctor only for this role play. Originally in life, I thought I'd be a doctor, but we all see where that panned out. So I guess I'm really, I was always prepping for a moment like this. Tiffany, anything you want to say before we get started?
Yeah, so one thing to keep in mind is I'm going to be using I statements. I'm really going to be focusing on trying to advocate for myself, communicating myself in a non-aggressive but yet assertive manner, while also trying to still interact in a neutral way without getting angry or mad.
Yeah, I love that. Love that. And so just a slight trigger warning, I am going to dismiss Tiffany. I'm going to be very rude. And so just if you're not wanting to listen to that and the role play, that is what we're going to do so that Tiffany is going to be able to use some of those interventions and skills she's talking about. Tiffany, just for the sake of this, why don't we say it's a telehealth appointment so I don't have to pretend that I walked into the exam room? Is that okay with you, just for the sake of...
Yeah,
Okay.
yeah, that's fine with me.
Okay.
I'm gonna make sure I keep my finger under wraps because I haven't had good experiences with telehealth doctors, but okay.
Well, we can pretend it's what you pick, in person or tele. I said I just
Oh,
wanted to put
telehealth is
we're
totally
doing
fine.
tele.
We can
Okay, I
roll
was
with
like,
it.
we're doing telehealth right now to record this, so I just figured not to make it sound as tricky. Okay, well, we'll just dive in. So, hi, Tiffany. It's been a few months. I did get your test results. Any questions before we get started with those?
Yeah, I was hoping that you could help explain some of the results that were given to me.
Yeah, well, hopefully I can explain some of this. So the test came back inconclusive. So what we're probably going to need to do is to do it again, just because uh, we did not get anything that we probably can use to give you any of those answers. So we'll do the same test uh, as soon as you're able to, and then we'll schedule the same appointment that we're doing right now for probably the next opening on my schedule, which right now it's probably 3 or 4 months out.
So I'm not understanding the reason we need to do the test again. It feels like a waste of my time and money and getting to a solution.
Oh, well, the test was inconclusive. Uh, so because it was inconclusive, that's why we just need to do it again so that hopefully we get some results that we can use, because the ones we have right now are not usable in the way I need them to be to make a recommendation.
I don't understand, like, are you looking for specific numbers? Like I feel like the inconclusive would mean we do something different.
Oh, well, I went to school. So because I went to school, I would be able to tell you what we need to do. And so I think in that way, we need to do this test again, uh, just because that's the way we're supposed to do this.
I don't think that you're hearing me and that this doesn't feel like the right avenue for what's going on.
Well, I'm sorry you're upset with the path that we're taking. I don't know what else we could do at this point other than schedule this test again and a follow-up.
This is really frustrating.
Well, I'll see you in 3 months. I'll leave the Zoom, and I think our receptionist will hop on here and they can get you scheduled and do the billing and all that. Okay, bye.
Role play is ended.
So, Tiffany, how did you feel? This is not me as your doctor, fake doctor person. How did you feel role plays ended? How did you feel with the way that was going?
Not gonna lie, personally, I wanted to punch you in the face.
Yeah, it's frustrating.
Violence is never the answer, guys. I promise, violence is never the answer.
No, but it evoke some frustrations.
Yeah, I mean it's like I was trying to tell you like this doesn't seem like the right path if you're getting numbers that are inconclusive for whatever it is the doctor's looking for that they won't even disclose. It just feels like they're on a like a line track and it's like why can't you like be open to more options?
Mm, yeah, and I'm honestly sorry. I was sitting there, I was like, I'd love to get a medical professional on this space. Like, I think that'd be so interesting to have a medical guest come in, uh, because I think we need to stay grounded right now in empathy for the patient and the frustrations they're having. But I also think there would be a very interesting piece about maybe why a provider could be very concerned. Not that that was the right way to handle it. I definitely Tiffany and I had to look away from each other because we have a really strong rapport, which I think makes it hard to be mean to each other. So we had to look away, but that's why I threw in that crack about, well, I went to school and this is like the way we. So that was not professional to say it
Yeah.
that way.
Well, it's not, but I mean, I would be lying to you if I haven't encountered people who have mentioned that their medical professional has like said things on that
Mm,
vein to them. Like there are appropriate ways, and I know there are great medical professionals out there that do that in terms of
yeah,
helping explain like this is the reason that we want to do this again. And like really walking
yeah,
individuals through it rather than just being like, oh, it's because I said so.
yeah. I just think about I would go to the prenatal appointments with my wife, and They were so kind at Christ Hospital and Liberty. Like they're actually pretty well known for this, like explaining everything, trauma informed, walking through. Like, I mean, I really appreciate it because, like, I'm gonna be honest, I was very ignorant to all of it, and so they were very kind and very respectful. And so I wish that that was the norm and expectation, but sadly, I think it is not. Do you think, Tiffany, we could do this again, but maybe I can just be ruder? Like, I don't know if that makes sense, but just even just really sassy, or you could be really sassy and I can be the patient. Because I think it's just like, I think it winds up a little bit. Hopefully, people don't come in, but I think it's the tension and this, like, the lack of any kind of understanding or communication happening. Like, what do you think, Tiffany?
Yeah, we for sure can do it again if you wanna add some spice to it.
I just think that one was a little too easy. It was like, okay, bye. And you would leave and be like, well, that guy's kind of a jerk. But I don't think it would maybe hit in the same, I don't know. I mean, it could, but I think maybe that one would feel mild compared to what some of my patients have shared.
Yeah. So do you want me to be the doctor this time and you be the patient, or what's your
What do you pick? You pick. Dealer's choice.
I'll be a doctor. I'll try and be
Okay.
rude.
Yeah, so maybe it could be blood work again, or I don't know. Like you could pick, and I didn't specify because I'm not a medical professional. I don't want to act like I'm faux pretending, but we can just pick blood work testing on something to see levels or something, and we could be like in disagreement about the things I need to do to improve them. I don't know. Does that feel
Yeah, I'll throw my own experience in there, and like, not a medical professional, not pretending to be, but I'll throw some jargon in.
right? Okay. Yeah. Okay. Hi, Dr. Tiffany. I thanks for making the appointment. I know it's been hard to get in. I just wanted to kind of go over the blood work. It's not shown up in my chart, and they said I had to come in to see you to talk about it.
Yeah, so we got your blood work back. It looks great. There's really not much we can do with the numbers that we got back.
Okay, I'm still feeling pretty bad though some days. So what are my next steps to kind of figuring that out if that didn't show anything?
Yeah, well, I mean, we can look at, like, are you getting enough sleep? Are you eating right dietary things? Are you exercising? Are you taking care of yourself? Maybe we look at, some depression, anxiety to see if that's kind of playing there.
Oh, well, maybe I know it's been a minute since we last spoke. I've been doing therapy for a few years and have already been working on that specific diet that you had mentioned I should do. And I am moving a lot more. And in that the plan back then was that it should make an impact on this, and it's not really doing that. So, are there other suggestions that you have or other steps I can take? Because I'm concerned with, it's just kind of it can get really serious. It's not there yet, but I'm fairly concerned of it getting worse at this time.
Yeah. I hear that you're concerned, but your blood work has come back great. I mean, there's not really any medications or any other modifications I can recommend to you right now.
Okay, so as far as next steps for me, it's doing the exact same thing and hoping for a different result. Am I understanding that correctly?
Yeah, I mean, that's kind of the plan. Like, whatever, doing what you're doing, your blood work looks great. Like, everything on paper looks like it should from our perspective.
Okay, if this were you and you were going through this experience, would you take that answer that just do the same thing and hope that there's a change at this point, or what would you do for yourself or a family member?
Huh. Well, I mean, the numbers kind of speak for themselves. Like, I know you're telling me you still have symptoms, but it's not coming from, the blood work that we did. We need to look at, your diet, your exercise, your movement, your stress levels, maybe other things that could be making you feel not great.
Well, I think I would like to get a second opinion at this time, just because I want to say I appreciate that you have the way you do this, and I'm not trying to tell you how you need to do it. I need a little more information or more steps I can take. Do you have a second opinion you would recommend, or a colleague I could check in with just to follow up on this, just because I do want to explore this more? And I'm hearing you say that's not something that you see as our course of treatment together.
Yeah, you can feel free to schedule with any of the providers here. You can talk to the assistant out front if you wish to schedule with someone else.
Okay, I will probably follow up on that. I do appreciate the time and wish we'd had a different outcome, but I will follow up with them at the front desk. Thank you for your time. End scene. Okay, that was
Well, you make it hard to be rude.
yeah. It is hard, I think, to be rude, but I think that speaks to like the human connection, right, and the human condition of like when you know someone, it's usually harder. And I guess I'm grateful that I have had lots of providers who are really kind. And this one I think is hard to play, but I do think um, you get at something, Tiffany. It's like I'm not understanding what you're saying, or you're not understanding. There's this big miscommunication, and we're trained as therapists to kind of identify that and work on that. But if you don't have a master's degree in counseling, or work as a therapist, it could be harder to kind of try to break down what they're trying to say. And so in that space, I was like, well, I've tried to ask it a couple different ways and see if there's any movement, and it was not going. And my intuition in that scene is that I need more support than what is going on. So how did you feel?
I was frustrated. That is close to a mimicked scenario which I experienced in my own medical journey, of where like everything on paper, as I was told, looks great. So there was nothing like medically wrong with me, and they just kept throwing antidepressants, anti-anxiety, and other medications at me. And it was like this, like, you're not hearing what I'm saying, you just are assuming that there's something else going on that I'm unwilling to address.
Well, and I think one of the lines that I really like that you said is like, well, we're just going to exercise and eating, which is just general, like, hey, these are health recommendations. But I even was just thinking about like, what if I didn't have any more time to go? Like, I was just picturing some of my clients have shared, like, they already go to the gym 3 or 4 times a week. They already eat a very set diet. They're not eating really anything that's unhealthy, not drinking, following everything they're supposed to. And they're still getting told to do that as the recommendation. Like, maybe a piece that's missing is just the why, and like kind of customizing it a little bit. I don't think it would take so long to fine tune this, but I really think we'll have to just check in with our networks, Tiffany, and see if we can find a medical professional that can come on in the next bit, because I just think, man, that would be so, because I know there's a reason, and I don't want to, but I also want to make sure we don't turn this episode into what happens in those settings where someone will come on and it's like, oh wait, well, this is the
Yeah.
way the system works for training. Because in the moment that doesn't really matter, does it? In the moment you feel like you're reaching out for help and someone's talking over you and dismissing you. So even if we understand why that could be happening, it really doesn't change the pain and feelings that we're having in that moment.
Yeah. So on that note, because I do work with a college that trains medical doctors. So I'd be more than happy to do another role play with you and like kind of mimic one of those experiences of how they are training people moving forward, to kind of like be comprehensive and hear people out.
Yeah, I just think we are all trained differently, and there's a strength to that. I don't know if I've shared this story publicly, but there is a provider. I can give her a plug, but that I also don't know if I mean, she's pretty cool, but I'll just say there was a provider that I found very direct when I was going to the appointments with my wife. I did not go through pregnancy, but I was going alongside my wife's pregnancy journey to go to the appointments. And I was just like, wow, she's just really direct. Not mean, not bad, but just very, very direct. And I was like, man, like, is that really necessary? And the reason I'm smiling is that when it came time, there's a few complications with my daughter, and so it was a little stressful. I tell you what I really wanted was just someone to come in and be very direct and tell me things and was like, this is what we're gonna do. And I tell you what, they made probably one of the most stressful days of my life a very positive experience. So that's just an example where I just want to give a shout out, where I think sometimes those things can be very good strengths. I think it's like almost like therapy. Like we need to know when we use this, when we use that. I think maybe that's where there's a disconnect, but I don't want to minimize the trauma some clients or patients are having, but I also don't want to come in with a big um, just attack vibe at medical professionals because I know that it's a lot they have to do. My God, Tiffany, could you imagine if we had my chart and our patients just messaged us like every day and expected a response that and we're scored on how promptly we respond like that? I think would be um, just so tricky. So I feel for them. I mean, even beyond the ones I know, I think they have a very stressful job. They do a lot to get there, and it's a lot, rightfully so, to expect. But also, I think sometimes we're all going to make a mistake or miss, is what we've said. I mean, I'd love to tell you everything I've said as a therapist has landed perfectly, but that's just not real life. Sometimes things just don't connect.
Yeah, I mean, doctors do have a shit ton that they're constantly like on their mind. I know it's been a while since I've volunteered at that college, but when I was there more consistently, like we would be pretend patients for young upcoming doctors. And the 3 to 4 page evaluations we would have to do on them after a simple 15-minute interaction of which they have to do an entire physical exam. It really puts in the perspective of like, holy crap, like they're from the beginning trained that you have 15 minutes to do this exam. And being able to do all of that, be empathetic, touch all the emotions in 15 minutes is
Yeah.
mind blowing.
Well, and this is where I feel rough and sad, is that I think for like, and I just, because if I just sit in my lens as a trauma therapist, I think about my clients that have these traumas and it hasn't gone well, and my heart breaks for them, and then my heart also breaks that there's this system that doesn't work
Mhm.
for doctors or patients, and then you also have some patients who are really abusing this system and then draining really everyone in it, like tons of messages, trying to
Mhm.
squeeze 5 things into one visit. Like, I think I just don't think it sets anybody up very well, to be honest. But I do think there's a difference between some of the patients we're talking about where they have literally just tried to talk to someone completely iced out. And then there are some folks who are wanting to control everything, strong arm everything. And so, just to be specific, we are not saying that this is the role play for how to convince your doctor to do this, do that, do this, do that. But unfortunately,
Just a miniature glimpse into like what some people might experience.
yeah, just to kind of have a conversation because at the end of the day, it is their license and they are responsible for the decisions they do and don't make. But also, we need to, there's going to be normal disagreements. And I think that's maybe a very nuanced conversation. Maybe we can keep picking up on. But if you guys have any ideas for role plays, let us know. But I do think we've established we'll bring in maybe some other professionals to maybe see what their thoughts are on how you could handle one of those conversations.
Yeah, yeah. I would love to hear other people's comments, concerns, and things of that nature. One thing I did want to kind of like transition to today, because we are 4 days into Pride Month, I did want to take some time to talk about like the trauma that the LGBTQIA community may or may not experience within this field as well.
Yeah, well, in regards to medical trauma, I mean, thank goodness for places like Equitas and the Cincinnati Transgender Health Clinic and doing some amazing, amazing work. But yes, very unfortunately, even just the fact that for folks who are transgender, they have to use their dead name on insurance paperwork to have their services covered if they're using their insurance. Like, I mean, one can understand the admin reason they do that, but like from a just point like that would, I mean, I can't imagine if like I have my whole life and identity and I'm this person, then when I go to an appointment, I have to look at that paperwork. Even if they put the parentheses of preferred name, it's still, I think, very traumatic for a lot of people.
Yeah, I can only imagine like the pain and the retriggering that occurs every time that you an individual goes to a doctor's appointment, has to fill out that paperwork, or is called by their dead name, because that's the only way they can receive services. It shatters my heart to think about someone has to go through that.
Yeah. Well, even just in Ohio, I guess it's for one political party, you get points if you bash on the queer community. So that's really pathetic and sad. But yeah, there's all types of things going on, and so I do think Pride was a response to trauma. Not I'm not in that community, so I'm not going to try to mansplain it, but just in response to this is outrageous. This is not the way. And so Pride to me is like reclaiming space. And I don't know. I think folks thought that maybe not everyone, but I think some folks may have thought, hey, everyone's kind of moved forward. This is something we don't need to go. And it's like, well, clearly that was not the case last year because a lot of people counter protested and pushed back and are trying to make the space that those have claimed, retake it and push. So I do just want to shamelessly say that there is more to the LGBTQ mental health than just trauma, but unfortunately, trauma is a piece that goes with it because of bigotry in society and people that feel the need to comment on how other people are living their lives. So just want to balance it. I know we're a trauma podcast, but I just want to make sure I say out loud, like there is more to that than uh trauma. Like being queer is not just trauma, but it does unfortunately tend to correlate.
Yeah, there's a whole spectrum that goes with that. It's just unfortunate that there's that trauma piece that tends to underline that spectrum. I just wanted to make sure that we kind of brought that into awareness, especially as we're transitioning into Pride Month and be talking about some of that trauma that is experienced, unfortunately within that community, and how prevalent it is in the medical field, like with the finding safe people for the types of surgeries that they need, and finding. I think it was just here recently that Ohio tried to attempt to pass that law where surgeries of surgeries would be banned for certain people.
Yeah, no, they tried to make a law where you couldn't call folks under 18 by their preferred pronouns. So you had to go off of whatever. It's horrible. Honestly, I just, I know politics can be something. I don't think someone's healthcare should be political. But I also just don't understand how one group who prides themselves on the freedom to express and decide on things feels so comfortable telling another group what they should and shouldn't be allowed to do. Kind of like people that show up to Pride and protest. Like, I don't go to the political party I'm not a fan of and protest, right? Like I could, but I don't. And it's just interesting. I don't know. I just think it's very interesting that folks rules for them, but not rules for others, not for them.
Yeah, yeah. It's disheartening and infuriating at the same time.
Well, I think we'll kind of maybe try to focus on some LGBT plus topics, of course, this month. But it's been lovely chatting with you, Tiffany. And thanks for being willing to role play. I know not everyone would have been willing to do that.
Yeah, it for sure wasn't easy. There were some emotions there, won't lie. Uh, as a human who has been in and out of the medical field for various reasons, it's a very easy topic to get fired up about.
Absolutely.
That being said, since we are kind of full-fledging into Pride Month, kind of a little off topic, plug or discussion. How are you supporting Pride, and how can we help our members get involved for those who are interested that want to get involved that just aren't sure where to start?
Yeah, Hamilton Pride was this past weekend, so I guess by the time this comes out, so that would have been June 1st. It was awesome. And also awesome how they handled counter protesters. They had Pride umbrellas, and they were walking around, and as soon as those protesters came, you couldn't even see all their hateful signs, and they handled it so peacefully. And also really awesome. Hamilton Police Department does such a great job making sure everybody's safe, protesters and the folks going. It's family friendly. Middletown Pride, I think, is the 21st. Cincinnati Pride was coming up. Covington Pride was this past weekend, but just to be clear, like there's different pride levels of things. So like some events are family friendly, some are not. And when we say family friendly, we're just talking about like the level of coverage with different garments and things, or maybe language used, not who is there, who is not, type of thing. Um, yeah, I think just caring for the people that you know who are queer, just letting them know that you care. But also just kind of like supporting things, like how great it would be to support business. I think this is a very important year, shamelessly, to support Pride because it's under attack pretty much on all sides, especially in Ohio. So maybe attending an event, supporting queer businesses, or letting businesses know you really appreciate that they are supporting Pride in different ways, or making that known. Because honestly, it's not in vogue or stockholder profit this year to do it, apparently. So if any businesses are putting their name out there, they really actually, well, I won't say that, but just, they're going to face some backlash. So just making our voices heard about what we can support.
Yeah, yeah. And then I know there's donation groups and online anonymous support groups and all kinds of ways that you can donate, support, whether you want to be in the public face or not in the public face, about how you show your support.
Yeah. What are any suggestions you have, Tiffany?
Oh, I think just being open, allowing yourself to have conversations, allowing yourself to be educated, allowing yourself to be wrong on the topic and learning as you're, allowing yourself to be immersed in what pride is, what pride stands for, and how people can embrace that in all different ways.
Happy Pride.
Yeah, happy Pride. We have a couple more Pride-based episodes we'll do for you guys, and then we'll see where we land.
Good.
Thanks for tuning in to this week's episode of Deciphering Growth. We hope you found our conversation helpful and insightful. Subscribe to our podcast for more episodes and check out our Patreon for more content. Don't hesitate to contact us on social media if you have any questions or comments. We'd love to hear from you. Until next time, keep growing.